The dark side of screen addiction, teen mental health crisis. The alarming reality of screen addiction among teenagers is leading to severe mental health issues, including depression, anxiety, and self-harm. While today's youth may appear to be naturally inclined to engage with screens, this digital upbringing comes with significant drawbacks. Experts have been raising concerns for quite some time about the detrimental effects that excessive screen time can have on the developing brains of young people. Recent studies have drawn a direct connection between prolonged device usage and rising levels of anxiety, depression, and in the most severe cases, suicidal thoughts. A pivotal study conducted by the World Health Organization, in collaboration with the Health Behavior in School-Aged Children Project, revealed some startling statistics. Published in June, the research found that 11% of minors feel that their lives are significantly impacted by their use of smartphones, computers, and gaming consoles. Furthermore, a concerning 32% of these young individuals are at risk of developing problematic usage patterns, which can disrupt their daily activities, relationships, academic performance, and overall emotional health. In response to this growing crisis, the Control-Z initiative, spearheaded by Mar España, the former director of the Spanish Agency for Data Protection, was launched on July 9th. This project involves 16 organizations dedicated to promoting responsible and moderate technology use. The primary aim is to combat the phenomenon of digital hyperconnectivity. To achieve this, the initiative has enlisted the expertise of neurologists, psychologists, and psychiatrists, including Abigail Huertas, a child and adolescent psychiatrist at Madrid's hospital Gregorio Marañón. Huertas emphasizes that we are navigating uncharted territory. On one hand, today's adolescents are remarkably adept at recognizing and articulating their emotional struggles without the stigma that once surrounded such discussions. On the other hand, many adults, including parents, feel overwhelmed and ill-equipped to provide the necessary emotional support. According to Huertas, mental health issues are manifesting at younger ages and with greater intensity. While definitive scientific evidence is still forthcoming, it is clear that the content consumed online and the algorithms that curate this content have a profound impact on mood, self-perception, consumption habits, and identity. It's incredibly challenging to avoid falling into the trap of attention hijacking, especially when most people are unaware of its existence, she explains. A critical factor that is often overlooked is the age at which children begin using screens. Huertas warns that the earlier this exposure starts, the greater the risk of hindering their mental and emotional development. This can lead to issues such as depression, anxiety, and even self-harming behaviors. The risks associated with screen addiction are particularly pronounced among young women, manifesting in various forms such as eating disorders, self-harm, anxiety, and depression. A 2024 study titled Exploratory Study on the Health Effects of Overexposure to Social Media and Screens from a Gender Perspective, conducted by Spain's Addiction Care Network and the Spanish Federation of Rehabilitated Gamblers, corroborated these findings. Lucia Torres, an expert in adolescent psychology, explains that self-harm often stems from unmet emotional needs. When external factors beyond a person's control inflict pain, it can trigger overwhelming emotions like sadness, frustration, and disappointment that adolescents struggle to manage. In these situations, self-harm may emerge as a coping mechanism, she notes. This behavior can create a false sense of control as the individual shifts from being a passive victim of external circumstances to actively inflicting pain on themselves. Torres further elaborates that the physical pain inflicted through self-harm can feel more manageable than the emotional turmoil, leading to a misguided sense of strength. The repercussions of self-harm extend beyond the individual, significantly impacting family and friends. Torres points out that loved ones often become aware of the internal struggles faced by the adolescent, which can lead to feelings of guilt for not recognizing or addressing their needs, as well as sadness and fear regarding the potential for recurring behaviors. In many cases, the immediate response from family members may inadvertently reinforce the self-harming behavior, as the adolescent may interpret the increased attention as validation and care. What is particularly concerning is that many young people liken self-harm to a drug, as it provides a temporary escape from their emotional helplessness. This behavior triggers a release of neurotransmitters that can create a cycle of repetition. Psychologist Luis Miguel Real explains that self-harm releases endorphins, which provide relief and pleasure, effectively dulling emotional pain. Additionally, dopamine activates the brain's reward system, further encouraging the repetition of this harmful behavior. Real emphasizes that addictions often coexist with various psychological issues, increasing the likelihood that individuals will resort to addictive behaviors as a means of coping with discomfort. He highlights that teenagers are especially vulnerable, and their screen addiction often serves as a form of self-medication, leading them to avoid healthier coping strategies such as seeking support from parents, consulting a psychologist, or engaging in physical activities. This avoidance complicates their path to recovery.